Hi, I'm Justin Raichle. Today on Wisconsin Doctors, women's health. We have a tendency to think about pregnancy and babies when we think of women's health, but it's much, much more than that. And we're on location at Upland Hills Health in Dodgeville to find out exactly what is all involved in women's health. And we have a great team of folks that we're talking with us today. We have Dr. Raichle Hartline, Dr. Timothy Raichle, and Dr. Maria Sandgren. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. Today we're talking about women's health, and we're on location at Upland Hills Health in Dodgeville. And I'm joined by a great team of specialists here, Dr. Raichle Hartline, Dr. Maria Sandgren, and Dr. Timothy Raichle. Welcome.
Thank you.
Thanks for having us here today. What I'd like to do is I'd like to start out by giving each of you the opportunity to introduce yourselves to our audience, although some of you are coming back for a second and third appearance. But I'd like to give you the opportunity to introduce yourselves to our audience, talk a little bit about where you're from, give a background of your education, talk a little bit about your passion, what got you into healthcare, and what brought you to Upland Hills Health. So, Dr. Hartline, let's start with you.
Yeah, I grew up in Virginia, and I came to Wisconsin after medical school for my residency. I did my residency in family medicine, but I also deliver babies.
Okay.
And I did it at a rural training track in Baraboo. So my intern year was in Madison, where I got a lot of kind of higher volume experience, but I really wanted to learn to practice medicine in a rural setting. So I did that for the second and third years of my residency. And then my other kind of focus and the other thing that drew me to Wisconsin was actually global health and kind of working medicine in international contexts. And so I did a certificate in that as well, and that continues to be something that's really, really interesting to me.
Okay. Yeah. So you came to Upland Hills Health because you wanted to practice in a more rural area.
I did, yeah. I was, there's wonderful doctors in the city, but it's not for me.
Sure. Oh, that's fine.
Yeah, and I think that I wanted to practice in a setting that was kind of where I feel comfortable. My husband's a potato farmer, and he feels more and more comfortable the further away we are from big groups of people.
Sure, okay,
Yeah.
Gotcha. Likes to be spread out, likes to have space.
Yeah, exactly.
That's great, that's great. Dr. Sandgren, what about you?
Well, I grew up in Stockholm, Sweden, and have
A
lived
little
in the
ways from here.
States.
How far of a drive is that?
Yeah, if you can drive, you're good. So I did medical school there at the Karolinska Institute, and then I came here for research, actually, and ended up staying, and I've been here for 25 years. In Wisconsin the whole time. Did my specialty training in OBGYN in Madison, University of Wisconsin, and spent a lot of my time working there as well, with some short periods here and there. I've always been interested in women's health. I've been, and women's issues in general outside of health as well, but that kind of guided me. And then I like the city. I'm not afraid of groups of people, but I think it's more personalized care here. The pace is different. I think there's more community involvement and just a calmer, more.
It's not as frenetic.
No, exactly. It's not as frantic.
Yeah.
And I like the quality of care that we can provide here, without some of the downsides of the big city. Yeah, exactly.
Absolutely. And Dr. Raichle, what about you?
Well, I grew up in St. Louis, Missouri, and that is where I went to undergraduate in medical school, and then chose to do residency in Madison, Wisconsin. And so and did my OBGYN training there, and then I was in the Fox Cities area for 4 years, and then back in Madison for the last 10. And so I'm a little ways along in my career, I guess. So I've been in Wisconsin for the last 17 years. So I like being in Wisconsin. It is a great place to practice women's health. And I think I was looking for a change, kind of a supportive environment where you could really focus on doing what you chose to practicing women's health in a setting where it's very well supported by the hospital and with a great group of partners.
Yeah, you have a great team here.
Yeah.
You got a great group of people that you work with. We got to take a short break. When we come back, we're going to be talking about why Upland Hills Health is a great place for women's health. It's Wisconsin Doctors. Don't go away. Welcome back to Wisconsin Doctors. Today we're talking about women's health here at Upland Hills Health in Dodgeville. And next we're going to find out why it's such a great place. Upland Hills Health is such a great place for women's health. And there's one member of the women's health team that couldn't be with us here this morning. That's Dr. Barbara Hostetler. And she's been with Upland Hills since 2008. And Dr. Sandgren, I just want to ask you, you've known Dr. Hostetler for quite a while now and have been working with her for over a year. Tell us a little bit about her.
Well, yes, I came here partially because I knew Dr. Hostetler, even from before. We were actually co-workers at a different employers for several years.
Yeah.
And we also have a private connection with kids in the same grades in the same school. So I've been running into her on and off and, talking to her about working here. And it just sounded like a very great place where you have good support from the administration, good involvement in the community. And Dr. Hostetler is very experienced. She's been working as an OBGYN for a long time. She did residency training in Memphis, Tennessee at a university program. She also has additional training in pediatric and adolescent gynecology.
Wow, okay.
And is also a very staunch advocate for women's health and women's issues and provide excellent care. And I'm really happy to be with her. And we get along great and we have a fantastic team here.
I think pediatric gynecology isn't something that people often think as being something that's necessary, but for somebody to specialize in that, I think is really great, and to have that here at Upland Hills is fantastic. Dr. Raichle, I'm going to turn it over to you for a second. Did you know Dr. Sandgren and Dr. Hostetler prior to coming to Upland Hills Health?
During my residency training, they were attending, so they were my teachers during my residency training.
Okay.
And so our paths keep crossing over time, and I think so. I know them well. And when I was in Madison, and Dr. Hostetler took this job 8 years ago, it was always on my radar. Because I respected her as an OBGYN so much that I think it. When I found out about this opportunity, it just made it that much better that she was here and Dr. Sandgren had just joined. I respect both of them quite a bit, and I think we'll make a great team working together.
So that influenced your decision to come to Upland Hills quite a bit. Is
absolutely.
That the folks who are already here,
correct,
kind of attracted you to work here?
Absolutely.
That's fantastic. I'm just curious to know, how typical is that to have that many paths crossed in a profession in the medical industry? I mean, is that pretty typical that you?
Well, I think it's typical for people that you like to work with. I mean, you can be in a practice where you don't jibe with your partners, maybe you disagree on patient care. But I feel like you find people that you work well with, and that's why doctors don't often stay in their first job.
Sure.
They're trying to find people they're compatible with.
Yeah, absolutely.
Yeah.
Because having a good team in place is really is important. Dr. Sandgren, I'm going to turn it over to you for just a second here. Why would you recommend that a woman come to Upland Hills Health for her healthcare screenings and appointments, other than the fact that you guys are just all awesome?
Well, there's that. Now, I think there is excellent quality care. I mean, we can provide pretty much everything that the big hospitals can provide, but with shorter wait times, and both for appointments and for procedures. We can provide personalized care. For instance, I've delivered all of my obstetrical patients personally. Yeah. I've been caring for them during their pregnancy and been here for their delivery, 100%. Which I don't guarantee that to my patients because we have a life too, and you can't be available 24/7. But as much as possible, and it's such a satisfaction for me, and hopefully a good comfort for the patients. So I just think this is fabulous.
Yeah, and Dr. Hartline, I'm going to just turn it over to you real quick. You've obviously you deliver babies here at Upland Hills. What's your most recent delivery?
Well, there's a patient upstairs in labor now that I suspect I'll deliver tonight. But my most recent delivery before that was just last week.
Okay.
And I have kind of my own patients who I follow in clinic.
Sure.
I've delivered a handful of those thus far, and then a few more as well when one of the other doctors isn't available. But not Dr. Sandgren. She's been available. thus far all the time.
Excellent. Well, we got to take a short break. When we come back, we're going to talk a little bit about the birthing unit and the staff and more about women's health here at Upland Hills Health, right in Wisconsin Doctors. Don't go away. And welcome back to Wisconsin Doctors. We've been discussing women's health here at Upland Hills Health in Dodgeville. And Dr. Hartline, I want to just jump back to you because you had talked about the most recent baby that you delivered, and there's actually somebody in labor as we're filming this show right now. Can you describe the birthing unit staff?
Yeah, well, you know, we have about 300 babies born here every year, which gives us kind of the experience to feel like we're very comfortable. It's not, you know, an unusual thing to have a birth here by any means. But there's still, you know, a low enough volume that people can feel very attended to and have really personal service. There's a lot of support for your desired experience. Our labor rooms are also our postpartum rooms, so there's not a lot of juggling of rooms from floor to floor. And it's a lot of times the same nurse who delivers you who would care for you the next day, which is a really a unique experience compared to kind of a more urban L&D experience. And there are, I think, 5 birthing suites in a triage room, and there's skilled nurses and a lactation consultant as well. And if for some reason a woman would need to go to C-section, we have a state-of-the-art OR and excellent staff there as well. And at any given C-section, there's going to be the surgeon, which would be one of us, as well as a separate physician to attend to the baby, and an OB nurse and a respiratory therapist who are all there for the baby, in addition to the team that's there for the mom. So
they've got you covered here,
yeah,
it sounds like.
Absolutely.
So that's fantastic. Dr. Raichle, what was your first impression of the birthing unit when you first came here?
Well, when you have been somewhere like Madison for so long and you have these large labor and delivery units, it's a little bit of a transition to think about things on a smaller scale. So you come in and what you find is that it's the same thing, just with smaller numbers.
Sure.
You know, the birthing rooms are the same,
Right.
the beds are the same, the baby warmers are the same, the staff supporting the baby after it's born, they have the same skills.
Yeah.
And so I feel like the idea that you need to go to a bigger center for better care is not the case unless you're higher risk for some reason. So I feel like my impressions were that it made me feel good that it was the same that anyone would have in Madison.
Right.
I use Madison as an example, but
Right. In another urban area or
yeah, I mean, you
like
don't
that.
have to go for a low risk labor, for example.
Right.
You don't have to drive all the way to Madison to get the same care.
Right, yeah. And
Or to get better care. I mean,
everything, people's specialties are so standardized nowadays that, I mean, if somebody could go to two people could go to the same institution and end up in 2 different places, and they're going to essentially get the same care then no matter where they go.
But I think the point was made that, it's not as busy. The care is focused on who's there.
Right.
And I think you get into areas where it's busy, and while it might be just as safe, it's not quite as personalized.
Right, it's not as personalized. That's the key. I want to just switch topics real quick here and talk a little bit about screenings, because we have a tendency to think, when we think about women's health, we think about pregnancy and babies, but there's so much more to women's health than that. And so there are preventative measures or screenings that we should be scheduling to make sure that we stay on top of things and keep ourselves healthy. And Dr. Hartline, I just want to jump over to you. What screenings or measures do you recommend for, let's say, young girls and teenagers?
Yeah, so having regular visits, kind of well-child visits with your primary care provider is important, just to sort of make sure you're meeting those developmental milestones, and having a resource for a girl to have questions answered about her body as it's changing, and making sure she's feeling kind of comfortable and confident as much as you can at those visits. The other thing is immunizations, of course, kind of through childhood, but especially as you get into the teen years, thinking about the HPV vaccine, which is actually a prevention of cervical cancer. It's just incredible that we can prevent a cancer with a series of shots. And the other thing is, as girls start thinking about becoming sexually active, we're available as a resource for that to help prevent pregnancy and to screen for sexually transmitted infections, because some of them can be asymptomatic and can have impacts on future fertility.
And I think those are important conversations that we need to be having with our kids always, and always checking in with our healthcare providers as far as what needs to happen in terms of screenings and prevention. So we're going to take a short break, and when we come back, we're going to continue talking about screenings and preventative measures here at Upland Hills Health. We're talking women's health right here in Wisconsin Doctors. Don't go away. And welcome back to Wisconsin Doctors. We've been discussing women's health here today at Upland Hills Health. And when we left off, we were talking about preventative screenings preventative measures that women can take through screenings that can help prevent certain health issues. And Dr. Raichle, I want to jump over to you because, we talked a little bit about young girls and teenager screenings that they can get with Dr. Hartline. But Dr. Raichle, I want to ask you, what considerations should women have if they're at childbearing age?
Well, first of all, I want to say that I feel like historically everybody thought of the annual visit as that's the time to get my pap smear.
Right.
And guidelines have changed to where it's as seldom as every 3 years. Mm-hmm. And I feel like that's sort of, we have to explain a little bit more what that visit is about, because it was about so much more than the pap smear. Mm-hmm. The pap smear is a screen for precancerous cells of the cervix. Mm-hmm. But other things in reproductive age women that would come up is there are women who need STD screening. Mm-hmm. There's a discussion about birth control. There's the routine screening for hypertension and things like that. But other things come up related to weight loss, depression screening. What I find amazing is that the visit may start off as seeming so simple, but after just sort of reviewing things and going through the visit, it's amazing how much you can get out of that visit that you didn't think you were going to get out of it going into it.
Right.
And I think, I think there's a huge benefit to being seen yearly, regardless of the change in the pap smear screening guidelines.
And we talked a little bit during the break about how people are sometimes very reluctant to bring up problems that they may be experiencing until it's really, truly a problem. They should have brought it up 2 years ago, and they
Right.
didn't. So I think, it sounds to me like this is a great opportunity for a woman to come in and talk with her doctor and say, well, in addition to having a pap smear, here are some of the other things that I've been dealing with. I think it's important to get those out on the table.
Right. I mean, I feel like a lot of things aren't brought up unless we ask.
Right. Yeah.
And it's hard to go in and say, hey, I'm having this problem.
Right.
But I feel like things come up during the visit.
Right.
Depending on the questions you ask, but it is an opportunity every year to bring up things that might be embarrassing or that you have been waiting to ask someone about.
Sure. And Dr. Sandgren, what screening should be routine for pre- and post-menopausal women?
Well, I want to emphasize too that it's still really important to keep seeing a gynecologist on a somewhat regular basis. Many women think, well, I'm not having babies anymore, so I don't need to see a gynecologist. Right. And not many other doctors, some family doctors do, look at that part of your body at all. And there are things that can be discovered that can be, addressed and taken care of for you. I think the mammogram is the obvious one. The guidelines for frequency is different. It changes a little bit depending on what organization's recommendations you read, but usually baseline at 40 has been recommended, and then every 1 to 2 years depending on personal history, family history. Colonoscopy at age 50 is recommended, and the frequency of that depends on what they find in the first one, and again, history. Pap smear screening are up till 65 if you have had normal paps. Cholesterol, diabetes testing, and anything else that your history or symptoms may suggest.
And some of those things sound like they're good for anybody, like cholesterol testing and that sort of thing. I mean, that sounds like, men and women should be getting that checked on a regular basis. So, Dr. Raichle, you talked a little bit about, you said some of the issues that might come up during a routine visit are things that people, women might feel a little embarrassed about. Can you talk to us a little bit about what are some things that you've seen that women should be paying attention to, but maybe are a little bit embarrassed to bring up when they go to see their doctor?
Well, I think when they're younger, healthy, maybe having their first few kids, that there aren't a lot of problems beyond the routine things. But I think as time goes on and bodies change, things change, like their cycles may become more abnormal, more painful. They may even be having problems with sexual function, pain with intercourse, things like that that really become an issue over time and as their body changes. And in answer to your question, I feel like those are some of those things that they're done with kids. They're, life is moving on. Maybe they feel like they don't need to be going in anymore, but these things are an issue over time.
Yeah.
Does that answer your question?
Yes, absolutely.
Yeah, okay.
And Dr. Hartline, what are your thoughts? I mean, are there anything that you think that is difficult for women to bring up, but that they really should be taking a look at?
Yeah, I think, the thing I think I'm the most passionate about probably is mental health, and that's a really wide swath. It includes, mood disorders. It includes intimate partner violence. I think has huge impacts on your mental health and something you can feel comfortable discussing with your physician. And then the other thing that I feel like is receiving more attention, but not necessarily a lot more treatment, is addiction, and that has a huge role in a person's mental health.
Absolutely. Well, we are out of time today. Thank you so much for all of you guys. This has been a great conversation, and I hope that you out there, if you know somebody who needs to get in to see a doctor soon or has been kind of not paying too much attention to something that's been bugging them, encourage them to get in and see their doctor. Encourage them to come to Upland Hills Health. Thank you so much, guys. From all of us here at Channel 57, we're inviting you to live longer, live better. We'll see you next time.